Hey Courtney, welcome to the Authentic SLP. How are you today?
Hi, great. I'm happy to be here.
Great. So tell me a little bit about yourself and your story and about Bayside.
Yeah, absolutely. My story with Bayside and really like speech therapy after undergrad started when I worked as an assistant. Um, and Bayside was, still just like a few years old at that point, and I had the opportunity to, work alongside with you. Um, learn a lot about the clinical side of things. Just coming out of undergrad, I really only had some like foundational knowledge. So it was a really good experience. And then went to grad school after a year of doing that, and you know, worked in a lot of different settings in grad school, and had a great experience there at Jacksonville University. And then I'd spoken with you close to when I was graduating, and you're like, "Hey, we're opening in Safety Harbor," and you know, it I didn't even have to think twice about it that I wanted to come back to Bayside. So it's kind of worked out perfect. Started working here, been here now 5 years since grad school, which is crazy to think about. And yeah, now working in a leadership role, still treating, but working as a clinical director as well. So it's been a full circle journey with Bayside, and it's been great.
Yeah, so just a heads up, everybody. Courtney is the clinical director of Bayside Therapy Specialists, which is our company. So she is going to represent Bayside today. So we're happy that she's here. And she's come from an SLPA all the way to a clinical director. So it's been an exciting journey. And Courtney really, I feel like, has gotten the mission and values of who we want to be as a company and like where our heart is to help kids and be research based and be the best that we can be. So she is a very good representative of our business as a whole. So I'm so glad that she's taking on this interview for us because it'd be weird to interview myself, and I feel like she's a great representative. So how has your perspective changed from maybe being a treating therapist to a clinical director in a leadership role?
Yeah, I mean, it's definitely changed a lot and been a little bit of a learning curve in the way where, as a treating therapist, I was always just focused on, my patient and that one individual, and then, how I could, as a therapist, educate myself more to help them. And I think that change going into a leadership role is now making sure that the whole team of therapists is feeling supported and empowered to help all of their patients. So it's kind of taking what I did myself as a therapist and trying to, help translate that into, the team. It's been a learning process, but it's also so rewarding to be able to do that. So
To give back, yeah, and to teach the people that really want to teach, to want to learn.
yeah.
So tell me a little bit about your focuses, like what you enjoyed here at Bayside, and like just as a speech therapist, and what like your journey as a therapist, and what you've learned, and what has brought you to. Because like now you're a qualified myofunctional therapist too. So
Yeah.
what's been your pathway to get there?
Yeah, so I mean, one thing that I've, always brought me back to Bayside that I loved is that, we're always changing, always growing, always learning. And that's something that I feel like, is one of our core values, right? Lifelong learning. And that's something that I really love and I value because I think, to stay driven and motivated in this career, you have to continue to learn and grow. And so, we started out, with just doing a lot of, basic speech and language and AAC we've always done. And, I've always really liked that and seen, such progress with that. And it's just, amazing to give children their voices. And then we started working on, oral myofunctional therapy. That kind of buzzword started to come up, and I know you had taken a training, and I ended up doing a certification for oral myofunctional therapy, and it kind of just filled in a lot of missing pieces, I think, when it came to treating, articulation therapy. And then even as we started bringing in more feeding therapy patients, it really just kind of was this bridge to, oh, okay, like this is why we're hitting this roadblock. And so, we started identifying oral myofunctional issues a lot and feeding patients and articulation patients that came in because I'm like, oh, well, you can't lift your tongue, or if you
Yeah.
can't have these foundational skills with your oral musculature, how are we going to make progress with these sounds or with these feeding goals? So and then we went on to take the Beckman oral motor training,
Yeah.
which was wonderful because that's really helpful, I think, for a lot of our kids that are younger too, or
Mm-hmm.
have a hard time following directions.
Yeah.
Um, yeah, so it's just been, kind of building blocks off of, one thing after the other, but
Right. And one thing I really like about you, and like that's why I think we get along so well, is that like we aren't okay with just seeing a patient and not making progress. Like we got to
right.
figure out what's going on so we can help this child make progress. And so when I don't like seeing I didn't like seeing articulation kids who had lisps or kids that had our sounds and they were never getting better and they were in speech therapy for 5 years. Like that was very frustrating to us, I think, together. So when I took the orofacial myofunctional course, I was like, Courtney, I think this is the answer to all of that. And then our kids they really did start getting better. The problem is with orofacial myofunctional therapy, I think you would agree, is that sometimes, well, the following directions is one thing, but if there's structurally something that we can't fix, it won't work. Can you
Mhm.
explain what that means? Like, what is, like, why isn't orofacial myofunctional therapy just appropriate for everybody?
Yeah, so I mean, oromyofunctional therapy essentially is our goal is for correct tongue rest position, swallow posture, nasal breathing, and closed mouth posture, right? So, if we have anything structurally that is, for example, like airway, if we have enlarged tonsils or adenoids, um, we could retrain this tongue position all we want, but we're still going to be compensating with mouth breathing because we have blockage in our airway. So it's essential to see ENT first. Or, if we have negative oral habits, if your child's still thumb sucking or using a pacifier and we have that tongue thrust position, we could be working on correcting that, um, you know, tongue rest position and correct swallow. But if we're still have these oral habits where we're tongue thrusting all day long, we're not going to make progress. So we have to address these barriers before we can have, effective progress in myofunctional therapy.
Yeah, yeah. Because a lot of parents will come in and they'll be like, they won't want to tell me that their child's still sucking their thumb or they're still using a pacifier, but I'm like, this isn't gonna work unless we do it together. And there is thumb sucking programs that we have, and there is, um, well, pacifiers are pretty. That's not too hard. I mean, it's hard, but like a thumb is really hard because you can't take it away from a child.
Yeah.
So, do you have recommendations for that? Because parents always ask.
Yes. I mean, well, I think a big thing that I tell parents when they have children that are thumb sucking, I mean, to start a thumb sucking elimination program, we do, a lot of times you need the child to be kind of aware and intrinsically motivated to stop thumb sucking. But something we can do to help if they're not there yet is usually there's like a trigger item that like
Mm.
children will hold, like maybe it's their blanket or another stuffed animal that they'll hold while they suck their thumb. So sometimes I'll recommend to parents like try taking that away, and seeing if that helps. I mean, there's lots of different things you could try too, putting a sock over your hand and things like that. Sometimes it's a little trial and error, but that's definitely a recommendation I give.
And one thing I always tell parents too is that if your child is sucking their thumb or wanting to use the pacifier, maybe figure out why are they still sucking their thumb and why are they still using the pacifier? Like what's the root cause for that? Is it anxiety? Like
Hmm.
should we look at anxiety? Maybe that's something that's giving them comfort. Can we give them comfort some other way?
Hmm.
Is it airway? Remember, because sometimes kids will suck their thumb to open up their airway so they can breathe at night. So then is it adenoids, tonsils, where we have to get those out before. So sometimes instead of just saying, "Oh, this is a terrible habit," like there's a reason for the habit. So if you figure out what that reason is, then that habit will naturally go away, or it's easier to break it. Because if you can't breathe and you're using this, and I take this away and I really can't breathe, it's not going to help anybody. So
Yeah.
That's so interesting. What other things does orofacial myofunctional therapy help with? Like, what are some other?
Yeah, so I mean, it could be a lot of times, you know, obviously mouth posture, right? So a lot of times we see difficulty with breathing, sleep, messy eating, any sort of picky eating, speech impairments. So difficulty with lifting your tongue up to make, you know, T's, D's, N's, S's, R's, those sounds, like difficulty making progress with articulation a lot of times. But yeah, I mean, those are a lot of the things usually that we see people come in with that trigger that, okay, there might be an oromyofunctional disorder going on. Yeah.
So, if a child's been to speech, what are some red flags that if they've been in speech for something for so long, they may need oral functional myofunctional or facial myofunctional therapy or oral motor therapy? Yeah. What are some red flags? Like, if your child is still doing this, you might want to see your oral facial myofunctional therapist.
Yeah, I mean, if they're continuing, like, if I would say, like, with younger kids, if they have that low resting tongue position and they're tongue thrusting, they have that open mouth posture. Older kids, R's and S's, that just won't go away. And this is why it's so important too. Like in the initial eval, we always look at the oral mech exam and look at those oral motor skills, because most times you'll find something there that's contributing.
Yes.
Speech eval. So.
And you have to rule it out. Like, so it's not always the reason. Like, I wouldn't say it fixes everything, but you have to rule it out. Like, we have to rule it out. Like, even for feeding. Like, no, oral motor, when we say oral motor, we mean how your tongue moves. And, like, it should be resting at the top of your mouth. And sectioned at rest. So that's kind of when she talks about oral motor and, like, skills and lips and everything. But, man, I just lost my train of thought. What was I saying? That I can't remember. Just how important it is. But that doesn't work for everybody. Okay, so feeding. Yeah. That's what it is. Feeding. Especially for feeding. Because, like, they sometimes, and like, if your kids don't have perfect oral motor skills, they may speak fine. That's the weird thing. Like, it doesn't affect everybody the same. But that's why you have to rule it out. Let's try oral facial myofunctional. If it doesn't help, then it wasn't the reason. Also, picky eating. If you have bad oral motor skills and oral posture, you can be a really picky eater. You can have bad eating, because you're not very good at moving the food around your mouth, or it can not cause any issues. Like, everybody's different, but you have to rule it out. So if you are a picky eater, it's a good thing to get evaluated, because it could be the reason.
Yeah.
But not always.
Yeah. And that's why we love our, other professionals in the community, right? Because it's usually never you go see a speech therapist and that's the end of the game, right? It's usually always there's multiple things contributing, especially when it comes to things like feeding. I mean, oral motor, yes, it could be a factor, but there's also, we have to look at nutrition. I know functional medicine is a big thing we've been talking about lately, looking at, any nutrition or, GI things going on. Obviously, behaviors can be part of it, sensory. There's just so many pieces to the puzzle. So that's why referring out is always good too.
Yeah, and I think that, especially with feeding, we always talk about all the different effects. Like, if your child's a picky eater, it's very rare you'll just see a speech therapist.
Yeah.
Or just a nutritionist, or just a psychologist. I know we talked about it with someone else. I think I was talking with in a podcast yesterday that now with RFID out, like, everybody thinks their children have RFID and that only psychologists should be treating these feeding issues. And, like, it's usually just psychology. And you really should be checking with a speech therapist, either GI. Like, there's lots of pieces to the puzzle. So
yeah, absolutely.
We have to work together. So as far as Bayside, we've kind of gone through a lot of changes, right? Like, trying to change with times. Where do you see us growing to as a clinic now, in our pathway? And then just, Why is that important and why does it matter?
Yeah, well, I think something that we've really tried to, emphasize lately is just our holistic approach, finding the root cause of, what that parent's concern is for their child. And, like we were just kind of talking about, we really lean into our community. We recognize that, we have a lot that we can offer and we can help within our scope. But a lot of times, as we were just saying, there are maybe some other barriers or some other factors where we need to refer out to our ENTs and our nutritionists and our dentists to, help those, children reach their full potential. So something we're really doing more is just strengthening those relationships. So just, finding out who's out there and, the people we work with already, just talking to them more, learning from them, just building that communication. And also just, keeping, our practice specifically, we have a very, small knit practice. So we have, I think, like 7 therapists here, which is wonderful because we're just able to, work well with each other. We know each other well. We, meet twice a week for an hour where we just like problem solve and talk about how we can, better ourselves for our patients. And, everyone has something different to offer. Everyone has different strengths. So, I mean, I look forward to meeting with the therapist every week because we all, help each other go over certain cases or, just share knowledge. And I think that that's the benefit of sharing patient wins too, because we're all so familiar with each other's cases. I think that's such a benefit of being a smaller practice because we just have that tight-knit connection and we have constant communication with each other.
Yeah, so our goal is to stay small but specialized. Because before, I think, and it's hard, when you're starting a clinic because you see everybody else do things and you think that you need to match it. But really, we are best, like we're not trying to grow to be 20, 30 therapists. Like we'd like to stay small and specialized so that we can help those kids that need it the most in our specialty. Because sometimes you can't, and that's why we're trying to do all this networking stuff now too, because we're not the best fit for everybody. And so we need to know who to refer to and then who to refer to us. So that's great. When you grow up and kind of mature a little bit and realize that you don't, where your niche is, kind of.
Yeah.
So I know another thing that we do at Bayside, which is a little bit different but still missing, is the AAC stuff.
Yeah.
Because I know it seems a little bit different, but it's just so important. Can you talk about the AAC program that we have?
Yeah. So that's, I feel like, where I started with Bayside at the very beginning is we were always so big on AAC. And it's really like the most magical thing because, these kids that come in and are 3, 4, sometimes even like 8 years old, and, nonverbal or minimally verbal, we're having behaviors and we're frustrated. It's, giving them that opportunity to communicate through, AAC, which AAC is, assisted augmentative communication, right? So this could be anything from signs to picture exchange to high-tech speech generating devices, right? So we, we want to give kids, total communication. So we don't want to wait until maybe they're saying more words because that's just going to end up being, more behaviors and more frustration. So, giving them any form of communication is the goal. So we have a program here where it's 8 weeks. So we, your child comes in, we trial different devices, different language systems, see what works best, what they connect with best, what caregivers, like too, because that's so important. And we spend, 4 sessions doing that. And then we do the application, we submit for a device. And once you're delivered that device, we do 4 training sessions where we really encourage not only training like the caregiver and the patient, but their ABA therapist, their teacher, anyone on their team, because we want this to be something that they use across all contexts. That's where we're going to see progress with it. So just training their team on the device and how to use it. And then, now they have that tool and they can go out and, have that source of communication. So, that's a program we've done here and we find it to be really successful. And Yeah.
Yeah, and to add on to that too, like the reason that we only do 8 weeks is because a lot of those kids that are nonverbal need more than what we have here. Like we have one OT, we might have a few OTs, but speech and feeding and oral is kind of our thing. And so, and OT definitely helps with that too. So we definitely need OT. But those kids that need more sensory, that need more things, like we're not the best clinic for you. But we know how hard it is to find someone to write AAC evals and get you those devices, and we're experts at it. Like we can get those evals written in a day, we can help you get funded. So we want to help your child get a device and then train the people in their lives that will help them use the device. But what happened was before is we've been seeing these kids for like years and years, and then they would forget to bring their device to therapy, or it wouldn't be charged, and they're not using it at home. So this way, let's train, instead of just using it with us, let's train the people in their lives to use the device that'll be used all the time. But we're probably not the best place to come to therapy long term. So once we realize that, like I said, our niche, like what we're good at, like we'll help you guys get devices, but in the long term. And we're also doing ALS evals for adults. We do some adult AAC evals too, which I've done. I've probably gotten, I know, because it's not, I hate this, but it's like, it's a lot of speech therapists and speech therapists think that writing AAC evals are so hard. If it's like something like ALS or nonverbal autism, it's pretty much going to say the same thing every single time. So the evals aren't hard to write. So for me, it's very minimal effort to make a huge impact. Mm-hmm. So for an ALS patient, like I know how important timing is. So I don't know if you even know this, Courtney, but we've gotten like 10 devices for ALS patients this year. So
amazing.
Yeah.
And it's so time critical too with those patients. So just the fact, so
we're doing that too because it's an easy thing, and it's how we can help the community. That we feel like we're really good at it, but long-term therapy, and if for ALS, you don't need long-term therapy. You just need to say you need a device. That's all. So it's pretty easy. Mm-hmm. Oops, I put this up here. So. Let's see. What shifts have you noticed in team culture? I think you kind of mentioned it a little bit before, but what changes have you noticed in team culture and client outcomes since making this shift to be more specialized and knowing what we're good at? Like, what have you seen? What are the positive changes you've seen in our clinic because of this change?
I think, as we've had such an emphasis on community collaboration and, referring to different professionals. And I feel like that collaborative communication has just become so much more natural. Mm-hmm. And, we've been learning more through that as well. Mm-hmm. And I know as a therapist, it makes you feel better and gives you that confidence of, when you get to that point with a patient and you're kind of hitting your limit of what's in your scope that you can help with, and you're in a feeding session, you're like, we're hitting this roadblock. You can help because other people in the community that you can refer to that can help with that part. And so, and I think patients really, I think it's more personal. Patients see that as, because it's true. You value the patient more, the whole picture, not just what you can do. You're looking at the whole holistic care. I mean, that's the end goal here. And I think the patients feel like they're part of a community, not just an appointment.
Right.
So
I love that. Yeah. That's definitely what we're trying to do more, because it's been really cool just interviewing people and learning more about what other people do, because like I said, you don't know what you don't know, and there's things that I wouldn't have even thought about that could help our patients. Mm-hmm. So the more we learn about other people's specialties, because it's not a silo, and it's just sad how we've been kind of operating that way, because I think it needs to shift in the entire profession of just more understanding other people's perspectives, and not saying, and like a lot of times I don't think it's one thing is the answer ever. I think it's multiple things that can help. So that's really important. So as far as, I like this question because we're staying small, so we don't want to have tons of people to hire. But when we get those good people in, as we stay small, what are some things do you look for when you're hiring new therapists? What are some things that are important for us?
I think like the recipe for a perfect therapist is compassion, and willingness to learn. If you have those two things, clinical skills can be taught. I think it's really those personal skills. So if you have that willingness to learn and that passion for your job and compassion for people, the sky's the limit. I just think that that's something we really look for, is just like who you are as a person, and if having that drive to, continue to grow and have that open mind. There's just so much that you can learn and that can be taught. So that's
I think that's important. And like we keep talking about like emotional intelligence, because that is important for every profession, but to understand your client, to understand your parent, to understand each other, like we're focusing a lot on like becoming better people too as a clinic, so that we can all be better employees, better people, happier, liking our lives better, really focusing on, I like to say like work-life harmony, like it goes together really well, instead of like work-life balance. Like they kind of go together. Like when I don't think about work all the time on the weekends, but like if I see a patient, I'm going to be happy that I saw, like it just kind of works together nicely. That's kind of what we're going for, instead of a separation.
I think when you feel like as a therapist, and something that's good about, I've always liked about Bayside, is when you feel valued as a person, not just a therapist, that shows in your work, and you do feel that balance, because I think that's where where you just feel like you're in that situation where you're just seeing kids to see kids, and it's this cycle, and you're just, a product of, healthcare, and that's where the issues come from, but when, Bayside, it's always how can we support you as a therapist? How can we, what makes you happy day to day to work? At work. And, I know you've asked us that, like, what would make your day better that we could have at the clinic to, we have the little walking pads that we can do our notes just for a mental health break. Like those little things help us be better for our patients, because we have that, we have that positive energy at work.
And like I said, it's like we're co-creating together. Like we want this to be, we're all part of this Bayside together and growing together. That's why we need to get good people on our team who also have some and not, because we've been through some negative energy, and that doesn't work here. So we're all pretty positive. So I love our team now. It's going really great, but lots of learning. So this is a good question. How do you balance clinical excellence with creating a warm family first culture for your team?
I think, the best way is to just like lead by example. I think it's important to hold high standards for clinical care, but like we were just saying, supporting the team and recognizing them as, people before therapists, and, making sure they feel cared for so that they can care for their clients. Yeah,
definitely. And so what advice would you give to new people that are either going to grad school or just graduated, and like who want to grow in leadership roles like yours? What advice would you give to them?
Honestly, just say yes to every opportunity. Honestly, I think it's not about, in leadership, I think a mind shift that I had to make was, you're not a leader because you know everything, because you never will. And that is something that I used to stress about. Like, I have to have the answer to everything. No, you just have to be open, and you just have to be willing to learn, and, reflective, and, as long as you just say yes to those trainings, say yes to being in those meetings and those opportunities, and you just gain so much from that. Taking any opportunity to like observe, or, I
remember when you were in SLPA, you would like, I remember, because like you were in SLPA, and I've had students from them, and like how different you were, because you didn't know what to do with a patient. I'd be like, here's a program, and like you would read it all and do it with them next week. Like when I gave you advice, like you followed through it and you did it, and then you saw for yourself what worked and what didn't. But if you never tried it and were just like, I'm gonna do whatever I want, you would never know. So like, I think it's great, and I think we're noticing this as a clinic too. All of these like social media is great, but some of these people from the 1990s had really great ideas in
Yeah.
the early 2000s, and we've kind of forgotten them.
I
And so
know.
sometimes going back to be like, I won't say the other one, we'll talk about that
Yeah.
later, but there's like moving across syllables, terrible pictures. I don't know, they're hand drawn and a lot of the words don't even make sense, but like that program for apraxia works really, really well. And you can take that and look on Teachers Pay Teachers and follow the same like kind of thing. You can update the pictures, but like some of those older programs like were really great too. So I love going back and learning that way because there's not as many programs. There's artificial myofunctional, like Beckman has stuff, but there's not as many like, here's a good program to follow step by step for your child. And when you're new, you need that because
Yes.
you don't know what to do. When
Yes.
you've been a therapist for a while, you can pull from this knowledge and this knowledge and this knowledge. But when you're at the beginning, you need a program to follow.
Yeah, and I think like you said, like sometimes the programs maybe like the wording or the structure of it is a little outdated, but like the foundation of it is works, and you can kind of
Mm-hmm.
just take that and make it your own. But yeah, I mean, I agree. There is so much less of that.
It is. It's just
I
like,
like
okay,
now.
I saw this on TikTok. You're like, I'm going to try it for the patient.
Yeah.
And I'm not saying that you shouldn't try it. I mean, honestly, as long as it's not hurting the patient or whatever.
Mm-hmm.
And, but at least kind of look back to some of those really research-based programs that came out a while ago because they had something. Those therapists had some good ideas. Not all great, Some of them are outdated, but it's a look at. What part of your job makes you the most happy these days?
Oh, I know. I mean, there's definitely a few different things, but I think right now it's kind of just the team growth. I think I just get really, my favorite thing is just working with people that are like passionate and motivated and excited and feel like how I feel about my job. And I think that is so important in a team. So I think when we have meetings and hearing, about a patient we maybe had been discussing the week before and guess what happened and this works and going over like a patient win or telling stories like that makes me so excited because I mean it just creates this positive energy and it's I feel very lucky that our team is like that because it's very motivating to work in that sort of environment. So I think just like seeing other team members excited about, things that we've been working on or new programs we've been doing that they're seeing progress with their patients, that makes me really excited. Obviously seeing progress with my own patients too is always, I mean, that's always the best part of our job. But I think it's the team growth because I truly feel like we have grown so much in the past
Yeah.
year and we are on our way to, great things. So, yeah.
Yeah, yeah, yeah. And I think you never really had to work. You got to do some externships, but like me working in a hospital, the clinics, home health, like what I think causes burnout to therapists, and the most is seeing, and you've been here because we've gotten better at this, but you've been where you see like 16 patients a day and you're making no progress because the parents just come back and there's no clear goals, if you see patients all day and there's no real plans and there's no real progress, you're going to get burnt out because it's like purpose. Your life needs purpose, and if you don't feel like you're making progress and your job doesn't have purpose, it's not a good place to work.
Yeah.
So having that purpose every day of like, I'm going to help these patients and then their lives are going to be better, then my life is going to be better, and then it all kind of wraps around. Instead of just seeing patients because they come in and parents drop them off and then you do some crafts with them and then they leave, like that's good. Everybody's going to get burnt out.
Yeah. I mean, it's such a ripple effect. Like when you have a session and something great happens and you're excited and you go out in the waiting room and you're just like wearing it on your face, like, oh my gosh, they did this today. And like the parent feels that and they feel motivated too to, okay, we're going to keep working on this because this is so exciting that, it's that ripple effect of, we'll continue to see progress that way. So, but it starts with obviously just changing our methods and making sure that we're, pulling the right resources and doing the right thing. And when we don't know exactly, when we hit that roadblock, knowing, when to pull other people.
And I would say, we haven't talked about this, but one thing that Bayside's not good at, but I do not judge, and I don't think it's bad if other clinics are, is that we do want to see progress. So we don't want to see kids forever. So even if they're not making progress, we're going to try to figure out what the root cause is. So then we're going to try to fix that and then come back. Or if kids are going to need therapy for a long time, which is fine, we're going to want breaks because kids get they get tired coming here and they need a break. So like every 6 months or every year, it's good to take a little bit of a break. So because then we get burnt out and they get burnt out, they don't want to come see us. It's a drive. So we want our sessions to be happy, productive, and like progress. Like we want everybody to want to be there. So, but there are other clinics that will, if you do have a kid that is high needs and you want them to go to the same clinic for 5 years, that there are clinics like that. We're just not them, if that makes sense. So that's just something to know. I think it's important.
Yeah, definitely.
If you could tell, last question. So if you could tell, and you're not a parent yet, but one day you're going to be great because you have so much to know before everything. So, but what advice would you give parents? Like 3 things of advice. Like from what I see every day, these are some things that you should do.
Like in general, or to like encourage communication, or just
In general, and communication, whatever you feel like. This is some advice I see, what I have seen, and
I would probably say just to celebrate the small wins.
Love that.
I see from what I see, like kids feed off of their parents' energy so much. So, it's very easy to look at, well, they're not doing this yet and they still have to do this. But I always like to sit in sessions and I'm like, yeah, but like, look at all of these things that, we came in and we weren't doing and now we're doing. And, the kids definitely feel that during the session when parents are excited. And so I think celebrating small wins, staying consistent, especially when it comes to like speech and language, progress isn't always, linear, and, there is plateaus, but progress will happen. You just have to stay consistent and trust the process. And, if there are those questions of, you're kind of hitting those plateaus, then opening that conversation with your therapist and talking about, what you guys can do. But I think consistency, celebrating small wins. I don't know a third one, but those would be.
Maybe like try to eliminate pacifier by 12 months or anything like that. I don't know.
Yeah. Yeah. Probably. Yeah, that's a good one.
Okay. I think it's a good one too. Yeah. Because if you can, if we can stop the habit before it becomes a habit, that would be great.
Screens are great, but even if they're educational games, it doesn't mean we should do them for 4 hours a day. Yeah. So eliminating that. Yeah.
Yeah, yes, we hear that a lot. Like YouTube, if we can just limit that as much as possible. And I have 2 kids that have YouTube on there, but we have limits on them because even though you think like they could be educational, like Coco Melon is designed, I don't know if you guys know this, but it's designed to constantly give them like dopamine rushes in their brains, like a high reward, like the opening the egg things. That's a high reward things. So what it does, it tricks your brain that you need that dopamine rush all the time, so that it actually makes them have less patience and be more impulsive. So you think these are good learning things, but actually, I have some theories, but actually it's training our kids to be more impulsive and not pay attention. So even if you feel like they're educational, like I would still like have some moments. So, well, thank you so much for your time. Truly appreciate you helping me out here, and I think I just love everything you said and how Bayside's growing, and just so glad that you're our clinical director. So,
yeah, got a lot of exciting things coming, I think, this year. So, thanks for having me. This was great.
All right, have a great day.